Hello everyone, welcome to our member-led session, Addressing Health and Digital Literacy to Help Improve Health Inequalities, which will be led by the Patient Information Forum with guests from Connected Nottinghamshire, Belonging Nottingham and Reaching People, Leicester. Earlier this morning, Hamid Khan mentioned how when he was told his appointments were on Zoom rather than face-to-face, this sudden change left him feeling illiterate, which has a real relevance to what we will be discussing this afternoon. If you weren't able to attend this morning's session, I'd highly recommend watching the recording on YouTube. It should be up in the next couple of days. Before handing over to Sophie Randall from Patient Information Forum, I will quickly go through a bit of housekeeping. We've tried to make this conference as inclusive, accessible, and interactive as possible. We welcome you all to display your pronouns in your Zoom name if you feel comfortable doing so. You can use the way that I've done it as a guide. We have a palantypist who is capturing speech and putting it into writing. You can either click on CC at the bottom right of your screen to enable captions, or my colleague has popped a link into the chat which will open a separate window. I'm told that captions come through a little bit quicker this way, so you might want to explore that option. We've enabled the chat box and I can see lots of you are introducing yourselves, which is fabulous. Tell us what brings you here today, and please feel free to share your reflections as you listen to our speakers. We're pasting a link in the chat to a collaboration document where you can share your contact details so that you can be contacted and contact others here today to carry on those conversations and plan joint action. We also have a Q&A box. That's also at the bottom of your screen. If you have a question you'd like to put directly to a speaker or to the panel in general, if you pop it down there, we'll try to make sure it's answered. We'll be doing Q&As at the end. If you see a question you like in the Q&A box, you can give it a thumbs up. You can also comment on questions that other people have raised. Without further ado, I'll pass over to Sophie Randall, Director of Patient Information Forum.
Hi, can you hear me? Yes, I think you can. Sounds like the speech is working. Hi, I'm Sophie. I'm the director of the Patient Information Forum. For those that who don't know PIF, we're a membership organisation, cross-sector membership organisation representing people who produce health information. So that's whether you work in the public sector, the charity sector, the private sector, the NHS. We're a cross-sector organisation. We represent about 300 different organisations and have 1,000 members. So that's a bit about PIF. Could I have the next slide, please, Laura? So we are very committed to change and bridging the digital divide, and this has been a key focus of our work for the last 12 months. And while we can provide guidance from the centre and work with our members, it's actually really great to have two of our members here today who are really doing that on the front line. So I'm delighted to have Rosie Atkin from Connected Nottinghamshire. PIF's been working with Connected Nots to look at the health and digital literacy of care plans, which are for long-term conditions and are included seamlessly in the NHS app in Nottinghamshire. They've got a seamless integration with Patient Knows Best, which is one of the most well-used personal health records. But it's also really important that when you look at not only the digital literacy, but you look at the health literacy of the plans that people are expected to use if they can. So it's a combination of those two factors. So we've been working really hard with Connected Nottinghamshire to look at those issues and working with community groups, one of which is a community group called Belong, which is an umbrella organisation representing migrant communities in Nottinghamshire, a very broad range of different communities. And we're really pleased to have John Hogby with us today from Belong. So we've been working with those groups via sort of digital channels, but as we move out of lockdown, face-to-face interaction will be really important with people who are digitally excluded, because by their very nature, it's hard to reach them from via digital channels. So we're also really pleased to have Reaching People from Leicester, who have been delivering digital skills training in the community to support healthcare, employment and benefits access for a number of years through some really interesting methods. And certainly in the last year, they have been working in the community on a holiday hunger programme. And I think it puts things into perspective when you look at their report on holiday hunger and you realise they're providing pens and paper to children this summer. So they're, we're talking about digital skills here, but actually even basic essentials are a real struggle for some people to manage to afford at the moment. Can I have the next slide, please? So just to put, before I hand over to our panelists, I'm just going to put some things into context around health and digital literacy. So we talk about people needing trustworthy information to make decisions about health, but the research shows us that up to 5 million adults can't find the relevant data in standard health information. 1.7 are unable to explain feelings over the phone. 9 million people can't use digital tools unaided. So there is a real challenge in accessing health information and pursuing goals like self-management, which we are being expected to do. So UK information skills, actually the ONS puts the average reading age at 9, and there are people who are under that reading age. There's 1 million people who can't speak English at all or very well. And about 50% of the population are below the sort of expected level at the end of primary school education in their mathematics. So that presents a real challenge when you're asking people to make decisions about their health and care. And what does that mean for health? It increases health inequalities. There's also a greater distrust of clinicians and increased negativity towards health and healthcare in general. And I think we've seen some of that in the sort of response to the pandemic. So could I have the next slide as well, please, Laura? So just before we went into lockdown, some months before, PIF did a health and digital literacy survey of our membership, because we could see the way that things were going with digital even before the pandemic. And it was a repeat of the survey we'd run in 2013, and we wanted to see what had happened. So we asked people if their organisation had a health literacy strategy in place, and actually only 13% had, and that represented very little progress since 2013 when we ran the previous survey. So the next slide as well, please. And if we looked at the sort of equalities impact of digital tools, 50% of organisations had considered that, but it's quite alarming to us that 50% hadn't when digital is becoming so important in health information. Next slide. So we had a multi-disciplinary panel to make recommendations. We had people from academia, we had people from NHS England, Health Education England, we had people working in NHS trusts, people working in charities, and other people working in private sector organisations. And I'm just going to spotlight a couple of the recommendations that we made, which were made in line with the 5 principles for the COVID recovery. So we would very much like to see organisations adopt the WHO definition of digital health literacy, which is up there on your screen now, which is the ability to seek, understand and appraise health information from electronic sources and to apply the knowledge gained to preventing and addressing or solving a health problem. But there's a real interplay with health and digital literacy, and I'll just give you 2 examples of that. So assuming that you can get into your digital healthcare channel that you're being asked to access, one of our trusts found that when they did Hotjar analysis, that 75% of people found it really hard to find the correct waiting room because it was medical language that was used to describe it. So instead of saying children's eye care, it might say pediatric ophthalmology. Another patient we've worked with recently who has blood cancer, most of her consultations are virtual and her test results are being put into her personal health record, but they are just abbreviations of the name of the test, and then they are numbers for the results, but it doesn't tell her if they're normal or actually what the tests are. So to her, those are completely useless. And I think the important thing to remember with health literacy in particular is you can be really literate, have really good reading ability, all of those things, but when you're in a very stressful situation, you can lose the ability to process information, particularly if you've just had a really horrible diagnosis. So next slide, please. So we would like organisations to look at the equalities impact of digital tools, but we also really want people to consider more general reasons for digital exclusion, including access and skills and motivation, really particularly, because there has to be a motivation to use a tool, and other specific barriers to individual groups and communities, because digital exclusion can be quite nuanced. Next slide, please. We'd also really like to see an NHS repository for health literate and translated information so that we get a common standard for health literate information, particularly to support shared decision making. And that also this should be available in a number of other languages, and digital makes that much more possible. Certainly we'd like to see the NHS app and other national projects available in other commonly spoken languages. We think that's essential. Next slide, please. And then community skills improvement. It's absolutely vital that there are people in the community, they are going to need support to actually have their skills improved. And actually for older people we've done some work with recently, they need to have that, they need access repeatedly. You know, it takes people time to build confidence to even go to training if they've been out of it for a long time. So that's really important, that they're via community channels in places where people feel really comfortable and happy to participate. So what are we doing about that now we've had that survey results? Why are we looking at that, and what are we doing? So we also did some research in the pandemic. Obviously, we all know about the inequalities that have been revealed, the massive acceleration of digital change and the reduced availability of printed material for people. So it's much harder for people to get information in printed formats now. We know the charitable sector is facing considerable financial constraints and having to look at their print budgets. And we know from the research we did on COVID choices that when we looked at what made people concerned about COVID, actually access to trusted information was really important. Those most worried about COVID, half of them lacked trustworthy information. When we compared it to people who were least worried, only 20% of that group felt they lacked trusted information. So trusted information in the format that people can use is really, really important. Next slide, please. We have a quality mark for health information, which launched last year, that some of you might have been looking at, and we're looking at tightening up some of the standards in that quality mark that 60 organisations are now following to get a really improved standard across the board for health information. There's more information about that on our website. Next slide. Just want to rattle through these so we can get through to the other panelists. We are offering training on health and digital literacy, and again our training is very practical. It's offered on a not-for-profit basis, so we're looking at an intro to health literacy and writing in plain language, but also how to carry out a really simple health literacy audit of your organisation from all your communication, and making sure that it's really easy to use and understand. And Julia Bell, who was at Breast Cancer Now and implemented an audit there, is helping us with that. We're also looking at equalities impact assessments, doing simple equalities impact assessments of digital tools, and Bob Gann is running that session for us. So the first session of that is going to be in April next month, and that's online. You can register online, it's an online course. So next slide. And finally, we have launched a health and digital literacy charter, and it's asking organisations really simply to become health and digital literacy friendly and to sign our pledge to do so, which is to assess the equalities impact of digital projects, make your information really easy to understand, make it easy to use in both print and digital formats, co-produce with users so you can make sure that you are actually hitting all of those targets, and train staff to produce things that are both health and digitally literate. And we'd be really delighted to have more signatories to our charter. It's on our website. All we're really asking people to do is make a commitment to those principles. So that is that's the end of my presentation. I think that's my final slide. We have got a Mentimeter poll, which I think is about to be launched. And that's really just asking people to say what you are doing to be health and digitally literate in the information that you're producing for your users, whoever your users are, and how you're pursuing those goals. How are you making stuff easy to use? How are you making your digital projects easy to access? What are you doing on that? So I think that is my final slide. So while that poll is running in the background, what I'd like to do is hand over to Rosie Atkin, who is the project manager at Connected Nottinghamshire, who has been looking at digital exclusion within an integrated care system. And Rosie's been leading the work we're doing with community groups up in Nottingham. So Rosie, over to you and John.
Lovely, thank you, Sophie. You've done a fantastic introduction for me there. So yeah, I'm Rosie Atkin, I'm Project Implementation Manager and Digital Inclusion Lead at Connected Nottinghamshire, which works across Nottinghamshire's integrated care system. And just want to talk to you a little bit today about what we've been doing to tackle digital exclusion across the region, and also how we've been working with community groups to really overcome health inequalities. Next slide, please, Laura. So our journey really started around 3 years ago, where as an ICS, we had a strategic vision to address sort of health barriers, improve access to services, and also reduce those health inequalities that people experience. And I guess following an extensive piece of public engagement in 2018, we published our public-facing digital services strategy that enabled people to access care in a convenient and coordinated way through sort of digital tools that we're familiar with in other aspects of our daily lives. Next slide, please, Laura. So through that sort of co-design and co-production, the Nots NHS app was created, which basically utilises the national NHS app as a single front door, but it also expands on its primary care functionality by integrating Patients Know Best to offer a wider access to secondary, community and social care services. So the tool ultimately gives people the ability to access a holistic view of the health and care, with the aim of really empowering them to manage this through inputting into care plans, undertaking sort of remote consultations, tracking their own health symptoms, amongst other things that are noted down there. Next slide, please, Laura. Thank you. So what we recognised quite earlier on is that actually to support our public-facing services project and vision, digital inclusion, health literacy, and ensuring that accessible information included within that Nots NHS app was key, really. So understanding that actually majority of the people that would really benefit from online digital services could actually be digitally excluded or experience health inequalities themselves. Next slide, please. So to get that better understanding of what this was like locally, we did a whole load of research into the level of exclusion across Nottingham and Nottinghamshire. So utilising heat maps and ONS data to really map out our region's exclusions level. We also utilised that public engagement piece that I mentioned earlier on to understand what barriers and challenges people found. And what we found was that actually our population's sort of exclusion predominantly followed the level of deprivation. So areas including Nottingham City and Mansfield, Ashfield, Newark and Sherwood, which are rural areas, had higher level of deprivation and were more likely to be digitally excluded. Next slide, please. So to overcome this, we embedded digital inclusion schemes at scale by supporting people to get online and sort of become more confident and capable of using digital tools. And these sort of range from digital support hubs in libraries, pop-up shops in job centres, where we provided free sort of training and technology support to our population. We established a digital workforce package to improve the upskilling of our workforce. And a big part of that was actually the creation of our Digital Champions Network, where we trained a number of health and care staff on digital inclusion topics, who now promote these sort of services to other colleagues and patients that they deal with on a daily basis. However, obviously, come March 2020, the UK sort of really began to see the effects of the pandemic. So we had to significantly change the way that we were working. So we started off by establishing a digital support line, transferring that help and support at the hubs over to a telephone line. We took some really good learning from other areas, and I think I noticed that Leeds are on this call in the chat. They've got a fantastic tablet lending scheme. So we actually worked linked in with them to see actually how they they established that, and we stole with pride a bit of their tablet lending scheme and tried to implement a small scale scheme in Nottinghamshire to actually face that barrier of cost of equipment. And now what we're really doing is focusing on sustainability and working with our community and voluntary sector organisations who are already providing a massive amount of support to people in their community, and giving them grants to expand on this work and embedding digital within the support that they already do. Next slide, please. Thank you. So digital health literacy is a really vital part of our overall work with the Nots NHS app. So to ensure that that tool is fit for purpose, we really needed to increase our knowledge of how our population understands and acts on health information. So that's why we enlisted the support from Sophie and the Patient Information Forum to conduct some focused health literacy research for us. Next slide, please. And we're working alongside PIF to engage with hard to reach and local community groups to ensure that that information is accessible, co-designing and working on co-production with these focus groups to actually look at the needs of the end user. So a couple of things that we've done is reviewed care plans, questionnaires and functionality with several sort of different groups in order to get that true reflection and representation of our demographic. And at that point, I would like to welcome John from Belong Nottingham to tell us a little bit more about his experiences with the focus group session.
Thanks for having me. Yes, the focus group session went extremely well, better than I actually expected. It was a really good learning curve because it helped us to understand the community in a wider perspective. The focus group, we had 12, we invited 14, 12 attended, and they were from the African community, from different parts of Africa, from Eastern Africa, from Southern Africa, Western Africa, and North Africa. And the community, and talking to them helped us to understand what it is that the community was about. We learned a lot in terms of their own perspective. We talk about inclusion and engaging, but it really did help us to understand quite clearly what we needed to do, and also how they saw things from their own perspective.
Lovely, thanks, John. So just on a final note, Laura, next slide, please. Just to say that the initial research that we did was obviously prior to COVID-19. So we're really committed to the continuation and improvement of that research and really actually taking a look at how the landscape has changed over the last 18 months. So we're currently in a process of revisiting that initial public engagement and research to understand if the barriers, challenges or needs and wants of our populations have changed at all, and then come back and actually take a look at actually how we can support them better to meet their needs. Thank you.
Thank you, Rosie and John. It's been a really interesting piece of work doing the work with the focus groups in Nottingham. And I think we found common aspects between different groups, but also some really particular challenges around language, and also about sort of information and how culturally appropriate some information is and isn't, in fact. So that it's been a really useful piece of work, which has revealed all sorts of barriers around health information and around the digital stuff together, which is kind of what we were hoping for. And I think we were really pleased with the engagement that we had from Belong, and the really open comments we got from people, which was exactly what we wanted. So I think hopefully we'll be able to improve some of the projects as a result. So I'm going to hand over now to Reaching People, and I think Amina Lunat is going to start. Is that correct, Amina? You're going to go first because you and your colleague Jenny are.
Yes, Jenny will be speaking first, but I'll bring up the slides for.
Fine, okay. And you have been working, we've all been working remotely doing our focus groups via Zoom, but through the pandemic and before, you have been very much in the community providing skills training to people and supporting people to get digital skills, mostly for employment and benefit reasons initially, I understand it. So I'm just going to, are you ready now? Shall I hand over to you?
Yep.
Perfect, okay. I shall mute myself again now. So there we go.
Okay, well, it's great to be invited to be part of this panel. Sometimes we don't recognise what we're doing until we take the time to sit down and plan and prepare to talk to others. So Reaching People is a partnership of member organisations. We've been growing during this pandemic because partnership and learning together has become more and more important to us all locally. In joining Reaching People, so we're not an infrastructure organisation, we are a membership organisation for the local voluntary sector and social enterprise organisations. In joining, we do ask for a big commitment to working together to share learning and to join up so that in partnership we can deliver more than each of our organisations can deliver separately. Next slide, thanks Amina. So I'm just going to talk a little bit generally about how what Reaching People is and how we work. So we have a shared commitment to lasting change by working together, as I said, and we do what we say we will. We are focused and practical. If you put the next bullet point on, thanks. We have a commitment to working with people where they are and to sharing the needs so that we can bring in different funding to address inequalities. And we absolutely value and respect each other, our ideas and our ethos, our resources and our diversity and our commitment. We do find that each year, because we ask a fee for membership, our membership changes slightly. And that depends on the circumstances of our individual organisations, where they are and what they gain out of working together. So we're very much membership driven. Next slide, thanks. And the next bullet point, you can put the next one on as well. So our projects change like everybody else working in our sector. Our projects depend on the funding that we have available at any one time. Amina's going to talk a little bit more about the MoneyWise Plus and the particular digital focus there. We developed a bit of a theme around the plus, so just to whiz through here, and we join up projects across the sector in Leicester, Leicestershire and Rutland. So Food Bank Plus is quite critical to literacy, health literacy and digital literacy. And it was a bit of an experiment to put advice into food banks alongside food banks, with knowing that the majority of users of food banks also have health issues and digital issues. And by joining it together, through their food needs, we've been able to demonstrate the value of that project working on the ground in community, already being taken forward in different ways through other member organisations accessing other funding. So we have NWise now based out in communities. That funding came through Feeding Britain, if you're interested, and there are some other projects around the country. We have another organisation which is a partnership in itself, which is Leicester Ageing Together, that during COVID has been working very much with older people and their digital access, starting with telephones, support, but actually training people while we've been in lockdown to access support networks on Zoom, and that is leading to current development, which we've called our VIC. We don't have any funding for it yet, but we have a prototype model, and we're talking to our local university about developing a virtual community centre. Obviously, it's an idea, it's something that's shared by all our members, and it's really where we hope that people could have a one-stop point of access digitally and be able to see all our member organisations in there. So we might have a bit of the citizens' advice, we might have GPs coming in or nurses to come in and run sessions for individuals. We might have group work, self-help group. We want it to feel like a community centre. We want it to have meeters and greeters, not little boxes in the corner with chats in them. But we're still working on where we're going to fund that at the moment. And of course, to get that all started, if you put the next slide on, thanks, Amina. We need to look at what we've got, what our starting points are, and what the gaps are. So digital exclusion is something in Leicester and Leicestershire that the LEP, the Economic Partnership, is only just starting to do some research on. We do know that it has had a huge impact on the uptake of, for example, COVID winter support grants, on mental health and isolation. The libraries being closed had a huge impact on where people could go for their support for MoneyWise Plus. And we have the issues of hardware and software, as well as training and access as a starting point, which Amina will come on to. But we have our assets, and our assets are what we are doing by working together and separately, by knowing our communities and by working with the individuals that have, and listening to their messages. So very much that commitment to working together, finding out what we can do and where we need to go. So I'm going to hand over to Amina, who's going to talk a little bit more about MoneyWise Plus and the particular work we did on digital access there.
Brilliant, thanks Jenny. Hi everyone, so I'll be discussing some of the work our team's currently doing with distributing devices to our clients, so for those who don't have access to technology. So a little bit about us. MoneyWise Plus started.
It sounds...
Sorry, I didn't realize I was on mute. Thank you so much. Great. I'll start again. Yeah, hi everyone. So my name is Mina, project coordinator for MoneyWise Plus. So I'll be talking about some of the work we've been doing with distributing devices to our clients, or those who don't have access to technology. So a little bit about us. MoneyWise Plus started in October 2016 and will currently run until December 2022. So we're a BBO project and it's led by Reaching People, and it's delivered in partnership with 6 other organisations within Leicester and Leicestershire. So as a project, we have targets to help individuals in achieving their employment goals, but we also believe it is much more than that. So we support our clients with financial and digital life skills so that they're kept up to date in the digital world and so that they can use these skills beyond getting a job. And so by taking a holistic, tailored one-to-one approach, we assist individuals to overcome a range of barriers before we can look at skills development. So we help our clients with benefits, universal credit, housing support, and so on. So more than 50% of our participants have a long-term health or disability. And this has an impact on their employment, financial and digital support needs. And since lockdown, we saw these barriers, so the ones that are on the PowerPoint, we saw them increase, which changed our clients' priorities. And they had urgent matters that needs to be taken care of for us before we can help them with digital or financial skills. And also many of our clients were not able to leave during lockdown or had to self-isolate. So they were struggling with accessing services and they became socially isolated due to health issues. And this resulted in changing the way we deliver our service. And now our team help clients with these barriers where possible. The team aided with getting immediate help with food parcels, gas and electric, housing, mental health and wellbeing support, alongside delivering our usual service. However, not being able to help clients face-to-face, this meant we had to move to remote support. And this proved to be a challenge as many of our clients did not have access to technology. And those who did have a device, they had very limited or no internet connection. So we had to adapt our ways. So for instance, we use WhatsApp to help clients create CVs. We had phone calls with our clients to help them prepare for interviews. We also introduced them to several online health services because there's been a lot of clients who weren't able to go to their GP for face-to-face appointments. So we introduced them to the NHS website and how to book an online appointment with their GP, etc. So that's some of the work we've been doing. But after a few months of being in lockdown and with the situation not improving, especially since Leicester was the first city to go into local lockdown, and we're still not out of it yet. So the team came together, we identified some of the barriers that were mentioned before, and we looked into how our team can help with this. And a major factor in play was that individuals were not able to access an electronic device, or they did not have the internet connectivity. And this resulted in many of our clients being digitally excluded. So our team, we applied for grants and we did call outs on social media for donations, and we were successful in sourcing some devices with the support of our partners in Leicester. So we had a case with a client, and she lost her job. She was evicted from her home, and not long afterwards, she was forced to spend her time in and out of temporary accommodation and living on the streets. And the longer she was out of work, her anxiety and depression worsened. And our client, she started to use alcohol more as a coping mechanism and was struggling. So she was referred to Moneywise Plus for support. And so with the help of our advisor, she was able to secure a suitable place to live, receive help from a food bank, and was provided with a tablet and internet data. And this was donated by the Good Things Foundation. And so to help our clients get to grip with the new tablet, our advisor worked with her one-to-one to provide digital support. And on the slide, you can see what she said. But receiving the device coupled with one-to-one digital support gave our client the ability to get back in touch with family and friends, former friends that she had long drifted apart from. And it wasn't long before she had built up strong support network around her, and access to the internet made her day-to-day life a lot more easier and opened up more possibilities for her future. She's been able to stay connected with close ones, keep up to date with online news, and she successfully secured a new job. So that's good news for her on that front. But with more and more cases of our clients struggling to access technology, we saw there was a need. So we decided to run this on a bigger scale. So we partnered up with Social Box. So we've been doing campaigns for secondhand devices of laptops, tablets, smartphones, etc. And so Social Box, they'll be refurbishing the devices to a working standard so that we can distribute it to clients who don't have access to technology. And through a campaign with Social Box, and this is supported by some of our partners like Leicestershire Cares, we actually received 27 laptops from our local council, Leicester City Council, which are currently being refurbished by Social Box. And we've also partnered up with our local university. So Democrat University, we've partnered up with them and they've donated 10 laptops and are currently supporting us in running a donation drive for more devices. And also in December, we successfully bid for 10 tablets from Good Things Foundation. And with the tablets, we also received MiFi devices and 24GB data. And this was distributed to our clients around 3 months ago. And as you can see from the figures, this had a huge impact in a short amount of time. So 70% were able to stay in touch with family and friends, 80% were able to stay up to date with important news like COVID-19 news and lockdown updates, and 50% were able to manage the health of themselves or a family member. So that's it from me. Feel free to get in touch or follow us on Facebook and Twitter. We'll be sharing more successful stories of clients who receive advice. Thank you.
That's brilliant. Thank you, Amina and Jenny. And it's just such an inspiring work that you have been doing there. And it just shows how life-changing it can be for people to have the skills and the access to then actually be able to access work, housing. It's the whole package, isn't it? And health is so entwined with all these other indicators. So I think that it was, really, really interesting work. And it is great you've had such a good response to the device recycling scheme as well. I was quite fascinated by the idea of the virtual community centre. And I do realise that in lockdown, in Leicester, you've had more lockdown than the rest of the country. So I guess that is a kind of pressing need. But I thought what really came across to me is actually how you work with your community and you really listen. I think that word listen was absolutely fundamentally important. So thank you so much for that and for sharing your work, because it was really fascinating. I think now that we have got Laura is going to share the Mentimeter results. Is that correct? So I think because we've just heard about what some of these other organisations are doing right now, we thought it would be really interesting to see what other people are doing. And I'm just looking at this now. So we've got Easy Read, and I think Easy Read can be really valuable, and it can be a real baseline for helping to produce other health literate information. Subtitling and producing BSL videos, I think that's really important, and that's a real challenge with the virtual consultations particularly. And I think this is what we would absolutely recommend, asking for people's input to ensure that language is simple and understandable. You actually don't know that until you start doing user testing, and people who work with health information or who just get blind to some of the terminology. So engaging with the community, working with local people. So some really similar responses there, asking people, okay, no, yeah. So all of these things we would recommend. So there's lots here that is really encouraging. And I just think it's really important just to raise awareness of these issues all the time, because we know as an organisation that right now, particularly with health information for shared decision making, it's becoming more complex. So I think that is some really useful, and I think it picks up on some of the questions. So we've got Zoom, Digital Hub. Yeah, exactly. Abbreviations, use plain language, Zoom classes. Okay, so I'm just going to now, that's really helpful, thank you. And it's glad to see that people are doing this work. So perhaps we could have a look at some of the questions now. And I think if I can invite all of the panel to feedback on these. Some of these are general, I'm just going through those now to see what we have. And some, Anthony, you've talked about literacy comes before digital literacy and people not having to disguise that stigma. And I think that is really, that is absolutely important. And I think that's one of the things you've worked at Reaching People, to build people's confidence to participate. I've got 2 very severe dyslexics in my family. They go to extraordinary lengths to hide their difficulties. You will not see them write anything by hand. And so actually sometimes digital can be a support, but for that, because you can dictate. But Jenny or Amina, can I just talk to you about how you've built that confidence to get people to go to digital skills training who have got particular literacy issues?
Do you want to pick that up, Amina? It's hard, is what I'll say. Yeah. But MoneyWise Plus probably has the lead there, don't you, in terms of getting people to realise that they need their help and support digitally.
Sorry, my internet is playing up right now, so everything sounds kind of robotic. I don't know if you can hear me.
Yeah, fine.
Yeah, can you repeat the question again, please?
It was about literacy and building people's confidence to even go for digital skills training, and how I know you've done some quite innovative projects to get people to build their confidence to even go and participate, because there is an assumption that people will just participate, but actually not everyone is ready because of that stigma that is attached to having difficulties.
And I think what's great about our team is the one-to-one support we provide. And the most important aspect is firstly to build that rapport and the trust between the advisor and the client. And only then can we kind of identify the needs and work one-on-one to provide the best support possible. So yeah, you're right, to build that confidence is definitely, we focus on that one-to-one and providing a bit of that helping hand as that one-to-one support, yeah.
And the other thing I would say is about being out where people are, so that you're not expecting people to go somewhere new to get that support in the first place. So delivering through a range of different organisations means I got a question in the chat about homelessness. Well, one of our delivery partners for MoneyWise Plus and a member of Reaching People is Action Homeless. So it's about spreading yourself through other organisations so that your message can get out there. In terms of the children's holiday hunger, getting the messages out about digital learning into food bags. So with the food that was going out, I know people talked about not having so much literature, but actually having a bag with MoneyWise Plus and the phone number on it to get your food in was one of the things, you know, to get the messages out there. And still putting leaflets into the food bags through the food banks is because if you've got somebody who isn't online in the first place, then they need the messages some other way, and word of mouth. And those case studies help sell the project if you know somebody who benefited. So which is where I go back to doing what you say you will. So having a reputation to deliver.
Yeah, and I think that word of mouth is really important. I think we've seen that, haven't we? And John, I think you were about to come in there, I think.
Yeah, it is. It's not easy. And one of the things that we've done in Nottingham is that we've developed an intergeneration project that's brought because we've got large, you know, elderly population. We've been able to bring the older generation with the younger generation through our youth program, and that's been quite successful in helping the young people not only to train and help the elder to develop digital skills, but for them to learn from each other. So I think it's really important to use what's not been available within your wider community, as well as bringing the community leaders involved. Yeah, it's been a fantastic project for us.
Yeah, and I think that's that is a nice way to bring the generations together, where you've got that option. I noticed one of the things that has come up in the chat that people have been talking about, and it's something that came up when we did the focus group with your members, John, was whether or not NHS, one, should there be universal free Wi-Fi around the country so that people can access skills, because that was an issue, wasn't it? Whether or not you're going to be using data if you haven't got Wi-Fi to download apps and use them. And also whether NHS services or helplines and stuff should be free. So I don't know if there's an option to do a quick vote on that, National Voices, or not, but that would be great to see what people think about that. But do you think that would be helpful, John? Just, you know, to overcome some of those issues that we were discussing last week.
Yeah, it will be very useful, because of lots of the points that Amina pointed out in her presentation, that we're suffering from those issues as well, because not everybody has a laptop, and not everyone can use, you know what I mean, mobile phones. So it's such a cross section of, you know what I mean, of people lacking sort of thing. So to have it free will make it a lot easier to get the message out to everyone, and also help us in terms of providing that digital training that we are so well involved.
Yeah, brilliant. Rosie, I've got a question for you now. It says, how are you able to engage with non-digital natives in the current climate? They have effectively become invisible. And I found that citizens have survey fatigue. So I agree. We've found that on this project, that we really have had to go and engage directly with communities, haven't we? So you've been doing a lot of this work in the last few months.
Yeah, so I would say it has been a real challenge. I think the best way to obviously engage with people and meeting people that you wouldn't ordinarily speak to is, how Jenny said, going out to those communities. But obviously that's a real challenge. We can't do that anymore. So predominantly we've been engaging people through word of mouth, through our GP surgeries, through our hospitals, and also working with the CVS organisation, so our community and voluntary sector, and getting sort of our services and support out as far and wide through those channels. But obviously I fully appreciate that we're not obviously hitting the most excluded people, because people that are digitally excluded aren't necessarily going to be utilising those channels that we're promoting to. So it is a real challenge, it is, but we're trying to sort of work our way through it one day at a time.
Yeah, brilliant, thank you. And there have been a couple of particular questions on the app, and also I think probably going back to some earlier sessions today about how people who, you know, so example, in one question here from Rebecca Mansell about how do you ensure deaf people have access to digital appointments, for example. I don't know how you've managed that in NOTS. I don't think you've been running those via the app, anyway? I think that's separate.
No, so that's a really interesting question and a really good question, and it's something that I probably need to come back on in terms of getting you a concrete answer to that. But we do need to up that, and we need to ensure that our services are accessible as possible to everyone within our community. So I can definitely pick that up and get you an answer to that.
Okay, brilliant. And the other thing, particularly on the app, that someone has asked is, how does it record? Does it record the patient journey? So the time between appointments, the patient experience, satisfaction with the intervention. So
yeah, so it's so in terms of the app, obviously it's the NHS app is predominantly primary care services. So across the whole country, areas can access GP practices and those services through the NHS app. Specifically in Nottinghamshire, we've expanded on that functionality. So people can input symptoms, can keep a journal, can interact with other health and care services, not just the GP, and it does keep a record of those interactions and those appointments with those services. So.
And I think from the focus groups that we ran, that was the functionality people really valued, the chance to use those care plans potentially, and to be able to keep track of their health and not have to explain their symptoms to every time they go and see a health professional. But clearly they need, they need the access to the technology, and then there's some skills training. I think particularly for older people, it's felt that perhaps that might need to be repeated on a couple of occasions. And there was the language issue as well, John, wasn't there, particularly for your community group? I mean, actually, the part of the NHS app which has the care plans is translated into a number of languages, Rosie, isn't it? I think we have about 33, 44, I can't quite remember the number, but certainly not very many African languages. And I think that was a barrier for John's group. I don't know if you want to come in on that, John, at all, on the language issue, John or Amina, if there's any issues that you've come across with either of you.
Yeah, the language was a very important issue, and that came across during the focus group that we discussed, because the way that people speak is very important, and it could also lead to misinterpretation of their own actual symptoms. So when we prepare questionnaires, we need to bear in mind the terminology that we're using and how it would come across to people from a different community. And then we also found out that when they talk about Africa, the meaning is also different from different aspects of Africa. So it made it more important that we engage with people and talk to them before we create the questionnaires and discuss their issues, because most of them speak backwards, from back to front, whereas the English speaks, frontwards. So the way that you talk to them and the way that you present the questionnaire, you need to engage with them really before doing so. That was quite fascinating discovery during that focus group.
Yeah, it was really interesting. And Amina, with the work you've done with MoneyWise, has that been an issue as well, the sort of translation of services or?
Yeah, that's right. So some of our clients, they don't speak English as a first language. So we've had to look at new technology to see how we can kind of provide support as best as possible. So like Google Translate, I guess, is the first option. We do work with our local council to have a language line procedure. So then we kind of look at that. We've also got Pocket Port, which is something that's come out recently, and I think it's a little device that you kind of speak into and it translates for you. So that's been really helpful a lot. But yeah, and then the team, we've had to come up with some innovative ways, or we try to look in the team to see who has the skills, who does speak a language, or looking at it externally. Yeah, definitely.
Yeah, and I think when we look back at what we worked on earlier in the year when we were talking about health information, saying actually having a central repository of translated material that's been co-produced with communities that is then accessible, is because translation, and to do it well, is so expensive, would be a really valuable thing, and it could really help tackle some health inequalities, I think, if people have got access to information that is in their language and appropriate. So I'm conscious that we are beginning to run out of time now, and I want to get to a couple more questions. So Anthony's asked about the donation scheme for the laptops and tablets and palm tops. And he's just asking really about, I think, about the sort of access to troubleshooting and repair if that comes up. Will people be able to raise issues directly? So I don't know what you've done about that, because that can be an issue if you get a technical problem. So I don't know what
that's something we've identified, and it depends on where we get our donations from, and I think that's something you see quite often with secondhand devices. We have partnered up with a local charity called E2, and we'll be looking at and giving the devices to refurbish and to provide that technical support. But that's something as well we are still working on. So if anyone does have ideas, feel free to kind of put in the comments. We'd appreciate that a lot, definitely.
Brilliant, thank you. And I think there was a question, so for all of you organisations in the voluntary sector, so that like would be Belong and Reaching People, it's how you work. It's about the competition for funding and how you can work together with commissioners to reduce that kind of competing against each other. And I think that is a real challenge when resources are scarce, the amount of money you have to put into bidding for funding. So I don't know if either of you have got any views on that at all.
I think I'd say that's the beauty of working together with Reaching People, because we can actually kind of collaborate before we look at a tender, see who's best placed to lead on it, because it's not always led by Reaching People centrally, and test out whether partnership is what the commissioners are looking for, because sometimes they say partnership, but they actually mean a lead and subcontracting. And we don't actually mean that, we mean working together. So there is a bit of a need to test out commissioners on what they mean by collaboration and what kind of partnership are they looking at. But when you're already kind of got a commitment to work together, you can actually look across, work out who's best placed, and then try and avoid bidding against each other, because that is so much of a waste of time. Obviously we don't know who's bidding from outside our area, but in terms of strengthening what we can do, that's a good way forward.
Okay, brilliant, thank you. I don't know if anyone else has anything to add on that point. Rosie, you looked like you wanted to come in on that.
Yeah, I mean, I completely agree with everything that Jenny's just said. I think it's working with others within your community to actually put forward a better case, really, isn't it? And actually, if you can do something on a front with other organisations that you work with on a regular basis, then you're in a better place, aren't you? So I completely agree with that.
Okay, brilliant, thank you. I think we have now hit our time, have we not, Rosie from National Voices? Got two Rosies on the panel. So I would just like to say thank you, all of you, so much for joining today and being able to share your experiences of working really with, you know, to get this digital skills and improve digital exclusion and to look at health literacy. So thank you all very much. And I'll pass back to Laura and Rosie now. Thank you, everyone.
Thank you all for joining us this afternoon and for participating in the chat and the Q&A. We really appreciated your thoughtful comments and questions. I echo Sophie's thanks to all of our speakers today, Sophie, Rosie, John, Jenny and Amina for their presentations, and to the team at National Voices and PPL for putting this together. And thank you also to our sponsor, the Health Foundation. We're going to take a short break now, but you can stay on the link here. At 2:15, we will be joined by Compassion in Dying, Macmillan and Future Care Capital, where they will be discussing the human within the digital, using authentic storytelling to influence policy and improve health outcomes. They'll be discussing the results of a survey, which is up on our Twitter. I believe my colleagues popped that in the link, but we'll retweet that, so it's right at the top. So if you did want to pop on to our Twitter and cast your vote before the session, you can do. We look forward to seeing you very shortly for the next session. Thank you.